Well, a little bit of healthcare and a little bit about surviving the cold. I'm Marcy Markusa. Welcome to the podcast. This is Manitoba. So yes, surviving the cold. We're going to talk to a teacher on the podcast today. She started a polar bear club. What does that mean? Well, it means that for all of you who are thinking, oh, back in the day, I used to go out even if it was minus 30. She's now getting parental permission slips, and she's taking kids out when it does go even colder than minus 30. So how's that working? What are the kids' reaction to all of this? We're going to hear that, so stay tuned. But we do begin with a healthcare story on the podcast today. This is part of our ongoing series of discussions that came out of one feature interview, the one with a nurse. You might have also clicked on that and had a listen on a This is Manitoba episode. She's a nurse from Health Sciences Centre. She has worked there for decades and in the emergency department on the front line. And she shared a number of things with us. CBC News is concealing her identity to protect her job. But she wondered in part of our interview if hiring more social workers to be in the ER could be part of combating what she calls sometimes the, quote, chaos of what's happening. And that is in regards to the number of people who are there and the long wait times. And one of the things she also raised as a growing concern is the number of people who are houseless and often they're not for medical care, but they're using the ER effectively for shelter.
It differs every day, so it's not really like a set number.
Yeah, I get that.
I mean, it's an average.
Yeah.
Sometimes we look and go, oh, we don't have any patients. They're all just here for shelter now. We got everybody else in. It just depends on the night and how busy it is and what's going on within the rest of the department. But
got it.
At triage, sometimes all of the people that are left in the waiting room are seeking shelter, seeking warmth, seeking food. I mean, not that we're not here to help the unhoused, but there's a whole group of people that are paid to do that. The shelter people, the people that are at the warm-up places. If you don't have a medical problem, you shouldn't be in an emergency room. I mean, mental health crisis definitely counts as a medical problem. A drug addiction counts as a medical problem. But if it's cold outside and you don't have anywhere to go, that isn't an emergency. That needs to go to a shelter, not an emergency room or an urgent care. Because I think they're getting overrun with the people, the unhoused population too, especially in this cold snap, right?
The Manitoba Association of Healthcare Professionals say that rising vacancies for emergency room social workers is impacting wait times. The group says there's a 48% vacancy rate for social workers in HSC's adult ER. And they've been raising the alarm on this since last fall. Now, Jason Linklater is president of the Manitoba Association of Healthcare Professionals and here to weigh in this morning. Good morning.
Good morning. Thanks for having me.
Before we weigh in on sort of, the social workers' possible role in combating some of the challenges we've heard and such, people may not understand the role of social workers in an emergency department, like the one at HSC, for example. What would someone there be doing if they are a social worker in the ER?
For sure. So it's certainly not just medical issues that clog up the ER. To a large extent, it is those social issues, and they move patients through, get people home safely, and free up beds so that other patients can be seen. A big part of what they do is handling all of those social problems. They do, I can give an example, actually.
Please do, yeah.
Let's say a parent comes in for a medical issue, and they're under the influence of a substance, and they have a child in tow. Well, there's clearly a social issue there where, in good faith, you cannot discharge this person with this child. And so a social worker would take control of that problem, unload the responsibility for that patient, so that the nurses and doctors and other medical staff can deal with medical issues and make sure that that person and the child are discharged in a safe manner.
So when you say, that they can help sort of free up space if it's possible, if it's appropriate, and they can help people get home. If there were someone in the ER and it was determined that their medical problem, and you have to triage them, there's a legal requirement here, right? If they present to the desk,
Right.
you have to triage them. But would a social worker potentially sit with a person and have a deeper conversation about why they're there? And if it's determined that maybe they don't need to be there, in fact, and you figure out that they are there for shelter and warmth, and that's the primary concern, could you safely take them out of the system and transport them to a shelter, for example, if that's their wish?
Yes, and under optimal circumstances, that is absolutely what would happen. But right now, there's that vacancy rate that you referenced earlier. One of the other issues that we have throughout the system, but specifically at HSC Emergency, is there's an 86% turnover rate, which is really shocking when you think about that. People don't normally take jobs and leave them within the period of a year like that. And that turnover rate is in the period of a year I'm talking about.
And you're talking specific 86% vacancy rate for social workers in that
Exactly.
ER position, or social
Right.
workers at HSC?
Social workers in that ER position, they can't retain people there. There's a bit of a vicious circle that happens. And once you are understaffed, the workload becomes greater and greater. And as people leave and you can't fill positions, that work falls on a smaller number of people. And then new people who come in, and it does take a significant amount of time for a social worker coming into the emergency room to be able to learn the ropes and figure out all of the different connections you need to make within the hospital environment, but also externally so that you're discharging people into the appropriate environment. So there's a big learning curve that has to happen with social workers, and people aren't sticking it out.
How many social workers are there right now in the ER, and what to you would be optimal?
I believe there should be 12, and there's currently 7.
12 and there's currently 7. Okay, so that's positions in the room. How often, like if I'm there, let's say I go to ER in an overnight tonight, is there going to be 7 social workers working that room, or is that what does a shift look like?
Yeah, that's shift too. So you know what? I'm not a social worker, just to be clear.
Mm-hmm.
But I do know that they do some shift. And so there's certainly not 7 there at during a day shift from 9 to 5 or something like that.
What do you think can be done to retain emergency room social workers? You said it's complex, but what in your view could be done to retain them?
Well, I think there needs to be resources allocated to training for sure. A lot of these people who come in to a new position are simply put with somebody who already has a caseload, and they're trying to train people who are immediately given a caseload as well. So it's a really difficult situation for these people to come into. Social workers also were part of the allied health grouping in the province, where we have 45 different professions, and social workers being one of them, and for a contract for 5 years, and currently they are contractless again. So there's not a really big impetus to go into this industry at the moment.
I want to ask you about where people possibly could be moved. Like if it's safe to move somebody out of the ER and it would be optimal for their care, it would work for the ER and obviously free up some space for other patients. I'm talking about the houseless population still here, obviously. We know that there is a program that connects down-housed patients with designated shelter beds. It's a pilot. We know it's been ongoing between different hospitals. Marion Willis at St. Boniface Street Links weighed in on this around the death of the man in the ER in January that happened at HSC. I wonder where social workers have fit into that pilot project or into conversations around that, since, as you're saying, they can be part of the solution.
For sure. And and I'm also talking about mental health and addictions workers as well. So all of that has to be dealt with on both sides. So you can't just deal with the hospital side, you have to deal with the community side as well. I do know that there's actually clinics that they're looking at that exist in cities like Toronto that actually are clinics, but they're intended for people who are in a situation where they're homeless or houseless and have nowhere to go. And for those mental health and addictions issues that don't require hospitalization. When I was listening earlier, I heard the nurse talking about the people who don't need to be in the ER because they're not dealing with emergency medical issues. And I think really to a great extent, that's exactly why the problems exist currently in the ER the way that they are.
You're right about Toronto. I was reading about that this week as well. Their clinic is standalone. It's right near the hospital in that city. And I apologize, I didn't write the name of the hospital down. But I was reading about it. So paramedics take them directly to there. So they don't even present at hospital first now. And then they have social services on site as well. And there's a number of different wraparound resources as well if that's a better fit for them. I wonder what your thoughts are on what we need to do moving forward in Manitoba. Then we have this pilot project. We've covered the concerns. We know what they are. But what do you think more about what the solutions could be?
I think the solutions really are about, at the moment, investing in staffing. Until Manitoba gets its staffing complement up to where it needs to be, all of the problems that I do believe government wants to fix can't be dealt with. You need people to do the work, and they're not keeping up with what they have now. So all of the really good ideas don't stand a chance without the adequate numbers of people. I think that's the very first step without even saying anything else.
We talked to the nurse as well, and one of the things she was just said, she was talking about how hard it was for her, just emotionally, just trying to make people feel good. She said some of the nurses will knit gifts and for people over the holidays. That some of the people living houseless that are there, they're there so often that they know their names. I mean, they're regulars. They have relationships with these people. But she said, I wish that her quote was, I wish there were a bus. Outside the emergency room, we could actually tell people, okay, don't come in here, go to the bus, and then the bus will take you to a shelter. What are the other reasons is there something going on as well where people are presenting to ER because at HSC specifically, there's not, geographically, there's not a shelter in that area of Winnipeg? Or what would have somebody go to the ER and not want to maybe go to a shelter? They're not finding a shelter or they don't want one?
Well, there's probably, it's very likely that a lot of the people with mental health and addictions issues find themselves in a situation where the emergency room seems like the most likely place that they should go to. I'm not sure whether they think of going to shelters or not, but their experience has been that if they go to an emergency room, they're somewhere safe.
They'll get help.
And
we obviously need to talk to people themselves about why they're making those choices. But Jason, thank you for weighing in on all of this. Really appreciate you being part of our series of conversations about our system.
Thank you. I really appreciate you having me.
Jason Linklater there in conversation with us at CBC. He's the president of the Manitoba Association of Healthcare Professionals. Well, you cannot have a podcast called This is Manitoba and eventually not have some stories on it about the cold. So, of course, it can get dangerous cold in this province, but it also can just be cold, and maybe you still want to go outside and enjoy it. We have been hearing from people who enjoy winter and even from those who don't, but they're trying to find a way. And Marsha Leary wrote to us. Marsha is a grade 3 and 4 teacher at General Vanier School in the city of Winnipeg. She's been getting students to embrace the cold in a fun, safe way. They've started a polar bear club. So kids, with permission from their parents, go outside on those really cold days. And we're talking on the days where otherwise there'd be that cutoff line where schools keep kids in for recess. She says the kids involved with the Polar Bear Club have loved it. Here's how it started. Oh, hi, Marsha.
Good morning.
So tell me about why you started Polar Bear Club and how the very first one went over.
Well, I can't take all the credit. I have a student in my class. I'm going to shout out to Emmett, who the very first indoor recess in December let out a huge groan when it came over the announcements that we had to stay inside. And it just made me think that over the years I've wondered why can't we just bundle them up and take them out for a quick little even run around the school, just burn off some energy and get some fresh air. And so him and I together created a letter to the principal and did some research about some other clubs that we found. online. And yeah, we put it out to the staff and then out to the families. And the first one, I had only 6 students. And yesterday we had 15.
Wow.
So it's going over well.
What's the reaction of the kids and what kinds of activities have you been doing?
Well, the kids, I think, love the fact that they're, outside in a small group with an adult. They don't often get to be out there. The first day it was me and 6 students from my class. So they thought it was pretty awesome to have that time just with me. They tried soccer one day, and we have a Gaga ball pit that they love, but they discovered it's way too cold. The balls hurt when they hit you and it's cold.
I don't know what a Gaga ball pit is.
Oh, it's actually a game, I believe, that comes from Australia. It's kind of like dodgeball, but you play it inside sort of a fenced area, round fenced area. Yeah, and you hit with your hands below the knees. Yeah, anyway.
Oh, yeah, I know what it is now. Okay, yeah.
But the balls are way too cold, so that didn't last long. So now it's sleds and shovels and race the teacher on the sled. Yeah, that seems to be the big one.
You mentioned, I understand that for the kids who are part of this, for some of them it's having a really positive impact also on their attention once they're back in class. Can you talk a bit more about that?
Yeah, absolutely. You find, especially on the days that they're inside morning, lunch, and afternoon, the last couple hours of the day can be really, really hard on some of them. Some days we don't have a gym class. Some days our gym class is in the morning, so by the end of the day, they're really struggling. And as much as we have access to wonderful things like projectors where we can do movement breaks and, we can bring in yoga and all of those things, being outside with other people, just, that unstructured, being able to just move their bodies, it's so helpful. Then they come in and they're just able to focus again. That heavy muscle work kind of grounds them. They can sit, in their space again, get back down to work if we have things to do. So it's definitely, I've seen a positive impact on my kiddos with that for sure.
I bet. What temperature won't you go outside in? Obviously there's parental, permission involved here, but once you get the permission, as long as kids are bundled, will you do the -30?
Oh, yeah. -30 is our cutoff that we don't go out at all. Like for the general school, that's where we wouldn't go out at all, anyone. So after -30, Polar Bear Club will go between -30 and -40. And again, the kids have to be bundled. The staff volunteers, so wonderful staff here. Lots of people have stepped up to say they would brave the cold with the kids. And it's up to the kids and the adult that's outside. So if the kids decide 5 minutes, they're done, they come back in. If the adult decides 5 minutes, we're done, they come back in. But we've lasted 15 all of the recesses we've done. And we do make sure the kids, are covered. Usually just their eyeballs are sticking out. Yesterday, one of my guys was like, "It's so warm out here." And he started to take his coat off. I'm like, no, the sun's shining, but no.
That's for coming inside when you've got that layer of sweat underneath and you're like taking off your toque, right? What's the reaction from the parents? I mean, those who have given permission, what's the interaction with them been like?
I haven't really had any feedback yet other than just the forms that have come back. Maybe we'll get some now. And we've been lucky this winter. I think we've only had 3 days where we've been stuck, kind of stuck inside. So we'll see this week. Actually, our class, our 3-4 classes, 3 of us are off to Fort White today. So we are really embracing the winter.
Wow. Marsha Leary, a grade 3 and 4 teacher at General Vanier School, talking about the Polar Bear Club. I love that it started with a kid groaning when they heard how cold it was going to be. We all feel like that sometimes in the winter, don't we? Well, thank you for snuggling in with your earbuds in maybe and listening to the podcast, or maybe you were brave in the cold yourself and standing at a bus stop. No matter how you listen to us, don't forget, if you continue to listen to us, please like and share.